My name is Joshua Marcus. I'm a board-certified neurosurgeon here at Elite Brain and Spine of Connecticut. Sciatica is a condition synonymous with something called lumbar radiculopathy, where one particular nerve, or maybe a few nerves, are compressed, and those nerves travel down the leg often in a pretty particular distribution. Some pain can travel down to the big toe, some pain can travel down to the little toe, and these particular distributions are super important for us to figure out exactly where the problem is coming from, right? And so part of my job as a neurosurgeon, right, and being trained in neurology and how the nerves function and where they arise from, is figuring out exactly how to associate a patient's particular pain with what we see on the MRI. Very often you're looking at an MRI and there's lots of things wrong, right? I'll tell patients, your spine's a mess, but it's really only one problem causing your pain, and that's the problem we're charged with fixing, right? We don't have to fix every little problem. In fact, going after lots of things that don't look great on an MRI often aren't going to make the situation better, and in some instances they make the situation worse. And so what we're trying to do is hone in on the particular problem and fix that in the least invasive way possible. Sometimes sciatica is purely a pain problem. Sometimes it's associated with weakness of the leg or both legs. In an emergency situation, it can be associated with weakness and numbness in the legs and dysfunction of what we call bowel and bladder. That is an emergency. Patients with any situation where they are losing function in the legs fairly rapidly, right? Hours, days, that needs to be addressed in an emergency room. Once again, I'm Dr. Joshua Marcus. If you or a loved one are experiencing any of the symptoms we spoke about, please feel free to reach out to Elite Brain and Spine. We are happy to help.